Hello, everyone. This is Caitlin Miller from the voucher office at HUD headquarters. And I just want to say thank you so much for joining us on our second try at this HUD-VASH 101 webinar. We hope that you didn't have too many problems connecting and logging into this software. And we hope that you get as much as you can from our presentation today. So on the line with me today, you're going to be hearing from almost all of the members of our HUD-VASH national team on both the HUD and VA side. And if please switch to the next slide. And now we are going to introduce ourselves.
Hello, everybody. My name is Nancy Campbell, and I'm the National Director of the HUD-VASH program on the VA side. I work at VA Central Office in the Office of Homeless Program.
Good afternoon. I'm Teresa Pittman. I'm the HUD-VASH Program Analyst at Central Office, and I'm also one of 4 regional managers, and I'm over Region 1.
Good morning, everyone. This is Ann Shahan. I'm also with VA Central Office. I'm physically located in the Seattle, Washington area and have responsibilities for the regions, basically Montana, a little bit of Texas, and West.
Good afternoon, everyone. My name is Deborah Lee, also with VA Central Office, and responsible for what we call Region 2, which is from D.C. across to Texas.
And hello, I am Catherine Greenspan. I am with HUD in HUD headquarters in the Housing Voucher Management and Operations Division, and I'm a housing program specialist.
Hello, this is Phyllis Malkinson. Like Catherine, I am a housing program specialist with the voucher division here at HUD. I work with Catherine and Caitlin on the HUD-VASH program.
And I'm Caitlin Miller. I'm also a housing program specialist in the voucher office at HUD. And now we're going to have a quick overview of what to expect with this webinar. So first of all, I just want to say, give folks a heads up that we are, this webinar has been produced in conjunction with the HUD SNAPS office, or the Homeless Programs Office, aligned with their Ready, Set, Go series. So thanks to the SNAPS office and the folks that they work with for this webinar for letting us use your system. Much appreciated. We will be, in this webinar, we'll be covering basic information on HUD-VASH and how it's different from the regular Housing Choice Voucher program. And as such, some of the information covered in this webinar may just be relevant to public housing authorities. Next. Our webinar will be 1.5 hours approximately, and we are being recorded, just to give you a heads up about that. And we will be posting a recording of this webinar on our HUD-VASH webpage. Also, please look for a feedback survey that will be emailed after the webinar to let us know what you think and how things perhaps can be improved in the future. Next, please. As you've already experienced, all of you are muted due to the high number of participants. And just to let you, to give you a heads up, the slides may move forward a bit slowly just because there's so many people that are logging in and watching this presentation. And if you have any technical difficulties, those are suggestions about what you can do, and you can also request for some assistance through the questions box on the toolbar at the side of your screen. Next, please. And if you have any questions for us, you can also use that questions box in the toolbar. And we will have 3 designated times for answering questions. We'll answer them out loud. We may not respond to you by typing them out, by typing our answers in that box. but we will pick out the most important and commonly asked questions and answer them during these designated times. So even though we're answering them just during those times, you can write and send those questions to us at any time. And if you have any questions that are not answered, you can contact your local HUD field office or speak to the VA Network Homeless Coordinator in your VISN. Next, please. So this is what to expect in terms of what we're covering in this training. The next segment will be delivered by Nancy Campbell, giving us a background from the VA side on the case management that veterans receive through the HUD-VASH program. We'll then have that question segment that I was talking about, answering some of those questions that you send in via the box in the toolbar. And then Catherine will go over VASH from the HUD side background as well as our operating requirements. We'll have another questions period. And then Phyllis will go over project-based vouchers and reporting requirements for PHAs. And then Teresa and I will tag team on some frequently asked questions, and then we'll have another section on questions at the end of the presentation. Next, please. And here are a list of resources. These handouts were sent to you in an email, and the emails that you received that gave you instructions on how to connect to this webinar. And then there are links to websites, to the HUD-VASH listserv, and to the VA SharePoint for HUD-VASH, which is just for VA staff only. And I just want to let all of you know that you can get to the HUD-VASH website by just Googling HUD-VASH, and it should come up at the top of the list. And click on that, and we will also provide a link to these slides on that website. Next, please. And now Nancy will get started with our presentation.
Thank you, Caitlin. I'd like to begin by thanking all of you for caring so much about housing our most high-risk homeless veterans that you were willing to take an hour and a half out of your really busy days to dial in and learn more about the HUD-VASH program. Personally, for me, it has been a great honor and privilege to work in this program and to have the opportunity to meet and collaborate with so many great folks within VA, at HUD, the PHAs, and in the community who are also working very hard in this program and have joined us in this quest to end veteran homelessness. I'm going to start by giving you a little bit of background about the HUD-VASH program and then provide a snapshot of where we're at currently, and then talk in greater detail about the VA's case manager's role in this program. So the first slide, please. I hope all of you are aware that we have a 5-year plan to eliminate homelessness among veterans. And in order to do that, it really is going to require a coordinated, collaborative effort with all of you. The Department of Veterans Affairs and HUD work together on the U.S. Interagency Council on Homelessness. This is a group of federal agencies who, of course, each have distinct missions, but all play a role in helping our homeless citizens, and they provide oversight for this initiative. VA and HUD have established some high priority performance goals that measure the impact on veterans' homelessness. The next slide, please. A little bit about HUD-VASH. It is the nation's largest supported permanent housing program, and it combines several features. One is HUD's Housing Choice Vouchers, and the VA's contribution is case management services that are incorporated to assist veterans in finding suitable housing and helping them in their quest to maintain housing stability and the development and implementation of a recovery plan. To date, we have close to 38,000 vouchers. These are both tenant-based and project-based vouchers When the program started in 2008, Congress had given us $75 million. We're about 10,000 vouchers. The next year we got 10,000 more. Third year got an additional 10,000, and last year we got a lesser amount, which brings us to that 38,000 or so. We already know that for 2012, Congress appropriated an additional $75 million. So hold on to your hats. We're getting ready to dole out another 10,000 or so additional vouchers, all put to good use in housing homeless veterans. At this time, we have about 323 PHAs who participate in this program, and VA has funded 1,543 case managers, housing specialists, peer support specialists, and administrative staff to work on the VA side of providing services to these veterans. We have also added 101 substance use disorder specialists because we recognize that many of the veterans in our program are high risk and do have substance use issues. Next slide. Here's a map that shows you the distribution currently of the vouchers we've been allocated. No surprise, California has the greatest number. You can see close to 6,000 vouchers have gone there. Florida also has a high number of homeless, and as do Texas and New York. The lighter green states are the next tier in terms of number of homeless, and you can see that in the upper plains and mountain states, there's a lower distribution of homeless. These are based on the point and time count numbers. Next, please. I mentioned that we have a high priority goal, VA and HUD, and that's to place 30,000 veterans in permanent supportive housing. By June 30th of this year, we are hoping to have less than 59,000 homeless veterans, and we are making really good progress. For those of you who follow the point in time count, you may know that in 2010, the number of homeless veterans was 76,329. In 2011, we were able to get that number down to 67,495. So that was a year decrease of 12%. These numbers and our progress in this program are reported to the Office of Management and Budget on a quarterly basis, and you can see some of the things we have to report to them, number of referrals that we make to the PHAs, how many vouchers get issued to families, and how many veterans actually get housed. Congress follows this program very closely. There is intense interest in it, and we want to make good in their trust that they placed in us by doing what we said we could do, which is using all these vouchers to house homeless veterans. Next. Just to show you how well we've been doing, here's a little graph that shows the number of veterans who have been cumulatively housed in the program, meaning veterans who ever received a voucher. And the red line shows the current number of veterans who are under lease. So with those almost 38,000 vouchers, we currently have over 28,000 veterans housed. So doing well, but we really want every single one of those vouchers in the hands of a veteran and resulting in them having a lease. Next. Okay, I'm going to move on and talk a little bit about eligibility for HUD-VASH and the different responsibilities that VA has versus the PHAs in determining who is able to utilize these vouchers. The VA case managers are responsible for determining clinical eligibility and the homeless status. The program is geared towards targeting the chronically homeless. We, in another slide, you'll see that we do follow the new HART Act definition of chronically homeless, and our case managers are the ones who get the history from the veteran and make that determination. of primarily whether they have been homeless more than a year and whether they've had 4 or more episodes of homelessness in 3 years and have some disability. The PHA's responsibility is to determine if the veteran meets the income criteria for that particular area and to ensure that they are not a lifetime registered sex offender under the state sex offender registration program. Next. A little more specifically about VA eligibility, we first have to determine whether the veteran is eligible for VA care. Just because someone served in the military may not make them eligible for VA health care if they have had less than an honorable discharge. So that's one thing that our case managers are going to check. Again, making the determination of whether or not they're homeless per the McKinney-Vento, which now is the HUD Act. And also we have to determine that the veteran is in need of case management in order to successfully live and maintain community housing. And the veteran also has to agree that they need and want and will willingly participate and engage with a case manager. Next. Okay, I talked a little bit about the HUD Act. It was signed by President Obama in May of 2010. It essentially reauthorized the McKinney-Vento Act, and there were some updates and changes, including the definition of homeless, which is a final rule, and the definition of chronic homeless, which is still an interim rule, I understand. And if you want to read more about the specifics of what that definition is, please feel free to go to that website listed there on the slide. Next. Some confusion about, some of these elements listed here. In the past, in the early 90s, there was another version of HUD-VASH, and I think, there's still some holdover from that. But the current program does not require the veteran to be sober or stable if they have a mental health issue. They aren't required to have a certain period of sobriety if they have, stopped drinking. They don't even really have to comply with treatment. Of course, we want to help veterans struggling with substance use or mental health issues to constructively deal with them, but it is not a condition for them to be admitted into the program. Prior treatment in other homeless programs isn't required. The VA does not do income verification. We will certainly provide information to the PHAs about what we know regarding veterans' income, but that remains the responsibility of the PHA. Same thing for the criminal background check. In the process of getting a history from the veteran, VA may find some things about the veteran's involvement with the criminal justice system, but again, we don't check or have any requirements about that, nor should the PHAs, other than, like I said, making sure that they aren't a lifetime sex offender and on that registry. Next. This model that I've been kind of describing about not requiring, sobriety or compliance with treatment is an evidence-based practice called housing first. And it's exactly what it sounds like. I mean, the first priority is getting the veteran into safe housing. And once that's accomplished, then we try to work on some of the other issues. It kind of turns things on end. In the past, people would say, well, once you get sober, we'll help you find housing. But, just think about it. How hard would it be to maintain sobriety or, be engaged in treatment if you have no place to live and you're on the street and you're in the same old environment with your, same network of people that may have contributed to the problem that they are currently experiencing. So, again, once we get them in the housing, then we try to wrap around the support services that may help them maintain housing. Because once they're in housing, of course, they are then subject to the same terms of release like anyone else would be. And, if they are, interfering with the other tenants' rights to enjoyment of their place, or there's criminal activity going on in the apartment, then actions would be taken, and we would try to continue working with that veteran in any way possible to help them stay housed. But again, there are consequences for those behaviors that sometimes are the incentive to help the person start dealing with those problems so they can retain their housing. Next, please. So the goals of case management. We talk about establishing a therapeutic relationship based on respect for individual decisions and providing hope that life can be better. We provide support for long-term recovery by working on a housing recovery plan. And then we're continuously reassessing the needs and the goals that the veteran has established for him or herself based on changing conditions. Sometimes they aren't going to be able to maintain sobriety, and it doesn't necessarily lead to discharge from case management. It will mean that they can't maintain their housing. It just may mean reassessing the goal and trying to, take other courses of action that may help get that veteran back on track. Sometimes it may require a higher level of care for a time. I mean, the veteran may decide that I really do need to work on, gaining sobriety, and it might require a period of hospitalization or, a different level of care in the community. But the main goal, like I said, is to sustain them in housing, to help them better integrate into the community, and to, become independent of us. That we don't, though there is no time frame for discharge or movement out of the program, it is the hoped for goal for all of our veterans that, they have the quality of life and independence that any of us would want to have. Next, please. Okay, a housing recovery plan. Again, it is an integrated plan. It reflects the recovery goals that the veteran has established in conjunction with conversation with their case manager. To maintain housing stability, it means paying the rent, following the rules of the lease. We need to make sure that they have income, whether it's through employment or through benefits, so that they continue paying their portion of the rent. If there are financial issues or legal issues that are an impediment for them, either in staying housed or having the kind of life they're hoping to have, because sometimes people have been disengaged from families, there could be custody issues with children, those sort of things. We, will assist the veterans in resolving those if we can, and do whatever is necessary to support their physical, mental, and social health. We also talk with the veterans about, how we can continue to monitor their progress. So you talk about frequencies of visits, where visits will take place. The goal is to have the visits take place in the community, in the veteran's apartment, so that we can really get a better sense of exactly how well that veteran is doing. Or if they're having problems, pictures worth 1,000 words, being in there, we can get a better sense of what some issues may be. Next. Okay, going back to the beginning of the process, where we work with the veterans on preparing them for a referral to the PHA, we will work with veterans in getting necessary documentation to help them obtain that voucher, whether it's an identification card, securing some income or benefits, or working on their credit history. And when functionally indicated, we will actually be even more hands-on and may need to actually help them complete that application form, make sure they get transportation to the PHA when they have to present their paperwork, or they have briefings they need to attend. We help provide organization to the process. We track it, like where are you today with this, what still needs to be done, what kind of time frame, we're talking about here. And in cases where it's necessary, facilitating communication between that veteran and the PHA. Next. So we see ourselves as coordinators, as the liaison with PHAs, with the landlord, as the case manager goes out with the veteran looking at potential apartments, and other service providers. Veteran may not have furniture, may not have, other household goods, may have health issues. So again, it's sort of like being the person who oversees and makes sure all these pieces are moving together in the right direction. Again, we talk about having regular home visits to assess the veteran in their own, apartment, to just see, if they really are doing okay in terms of, preparing meals, keeping the place clean, all the things that we all do day to day. And also to make sure that they somehow get connected to the community, because for some veterans, being in the apartment on their own sometimes leads to isolation. They may have been on the streets or in shelters used to being around a lot of people, and suddenly it seems strange to be all alone. So, we try to find healthy outlets for their need for social connection. Next. Again, sometimes the treatment plan will need to be revised as the veteran reaches goals and then maybe needs to determine new goals, or their treatment needs or care needs change. And like I said, sometimes they become so independent that they really don't need it anymore, which is a good thing. Next. But sometimes there are negative terminations. If the veteran or the and the family refuses to engage with the case manager, doesn't keep appointments, won't answer the door, maybe drops out of sight, no one has a clue, where that person has gone to. If there is no way to keep engaged with that veteran despite every effort on the part of the case manager, then that might indicate the need to terminate. Next. But, hopefully that's rare. We don't, we have been monitoring reasons for discharge. VA case managers have a goal that no more than 10% of veterans on their caseload would be discharged for an adverse reason. So that means the majority are really doing well. And, as they stabilize, the frequency of the visits may actually decrease. We try to give them some trial periods without this kind of intensive case management to just see how well they're able to do. And case management may stop completely if there's mutual agreement between the veteran and the case manager that their objectives have been met, and that they really no longer require contact with us. So of course the door is always left open, because we know that it's not always a linear process. Someone may be doing really well, and then all of a sudden they encounter problems, they need a little extra support, and of course we always want to be there to do that. Next. In the case where the veteran has successfully completed case management, it is not necessarily grounds for terminating the housing choice voucher. If possible, if the PHA has other housing choice vouchers, we would like to see those go to veterans. They are not subject to the PHA's waiting list because they're already a participant in the housing choice program. And by giving another voucher to that veteran, it then frees up the original voucher to go back in the pool to be reissued to another homeless vet who could really benefit. If the PHA does not have an alternative voucher, then the veteran would continue on with the HUD-VASH voucher until either by income reasons he no longer is eligible or a different voucher would become available. And that is my last slide. And if there are questions, please type, and we will try to answer best we can. But thank you very much for your kind attention.
Great, thanks, Nancy. And Teresa, you're going to be bringing up some of the questions that have come up.
I am going to be bringing up some questions. So this is Teresa, and one of the first questions that we saw, I'd like Anne, if you would please comment on the HUD-VASH policy for women with children.
Yes, women with children or men with children can use HUD-VASH if they're eligible by other standards for the program, and have those children or dependents or family members added on to the lease as part of the family that's accepting the voucher. The veteran and the family members that are referred for the initial lease or the initial voucher are all evaluated on the same criteria regarding sex offender status being a lifetime requirement. So if any family member joining a veteran, male or female, as a family member on the voucher, if they have a requirement to be a lifetime sex offender, they would not be allowed part of the voucher. Other than that, family members can share the voucher with the veteran.
Okay, great. Thank you. And Nancy, there was a question related to the directive to the local public housing authorities requiring HUD-VASH to have been in grant per diem programs for less than 90 days, and any potential methods for connecting the veterans who have been in the grant per diem greater than 90 days prior to that directive. And they're wanting to know kind of what the how that works, I think.
Yes, a good question. We actually have had discussions with HUD about this, and the decision was that the veteran would need to meet those two conditions I mentioned earlier, either be homeless a year or have more than 4 episodes in 3 years, but they still could be in another program and be in that program for more than 90 days, provided the application for HUD-VASH is made within 30 days from the time that homeless veteran is first assessed by us. So to say it another way, let's say a veteran is assessed on the 1st of the month and goes into the grant per diem program, but on the 29th day, the decision is made to pursue a HUD-VASH voucher. So as long as that voucher, referral is made within 30 days, the veteran could stay in the grant per diem program or other program as long as it would take to get them housed. So it could be more than 90 days, and that would not count against them. It would still meet that definition of chronically homeless and still would be able to pursue a HUD-VASH voucher. I hope
Great, thank you. Another question is HUD-VASH meant to be a permanent housing solution, and what happens to veterans who recover from substance use and become employed and then want to go on into the community? We'll have another piece of that Caitlin will answer later. So Deb, would you mind to answer this question?
Sure. HUD-VASH is considered to be a permanent housing program. The housing choice subsidy is there as long as the veteran and their family needs it. But our hope is that the veterans work towards meeting their recovery goals with emphasis placed on housing sustainment and permanent housing options, but they can be referred to other self-sufficiency programs in order to purchase their own homes. So our goal is to actually assist veterans with getting into other types of housing, as Nancy mentioned earlier, so that the subsidy can be used for veterans who are entering the system and require case management services.
Great, thank you. And then I'm going to answer this question. If vets are allowed to be non-compliant, what is the point of case management if they can turn right around and refuse it? And for the first part, and you probably heard this in the presentation, veterans who come into HUD-VASH have to be willing to participate in case management as a part of the program. And so if they are not following case management, then there is a way that we can, after trying to engage them and get them involved and working with us, if that still doesn't work, then there is a way to terminate them from the program. The other thing is that we do believe very strongly in the Housing First model, which has been shown to be effective, that people want to keep their housing, and so they really will work with us to try to maintain that housing. That doesn't happen in all cases, but if we're targeting correctly, it will happen in most of the cases. And I believe we're out of time. If we have any more, then we will try to talk about some of the case management requirements. But for VA folks, we should have some direction on that soon. Thanks.
And I just want to say, this is Caitlin, I just want to say we are receiving a ton of questions, and thank you so much for sending them to us, but we may not be able to get to them all. So if you are not able to get a question answered, again, please contact your VAMC, your network homeless coordinator, or on the PHA side, please contact your HUD field office, and we can get those questions answered. Next is Catherine.
Yes, thank you, Caitlin. I'm going to talk about the HUD background and HUD-VASH operating requirements, and there's going to be some overlap with the information that Nancy already presented to you, considering that that there is a lot of interaction between the programs and between the VA requirements and the PHA policy and HUD requirements. Next slide, please. What I wanted to do first is give you a little background. There was actually an earlier HUD-VASH program, and between 1992 and 1994, more than 1,700 HUD-VASH vouchers were awarded to 35 PHAs in what we would call the original HUD-VASH program. It was quite different, and there has been some confusion, particularly in the early days of the new HUD-VASH. There were VA sites and PHAs that thought that the old rules applied, and some that were actually reporting the veterans who were being assisted through the original HUD-VASH program. But that original program, the homeless veterans were required to have severe psychiatric or substance abuse disorders to be eligible. And clinical services were also provided by the VA in that program. In 2008, there were still more than 1,000 veterans that were being assisted through that initiative, the original HUD-VASH program. Next slide, please. Next slide, please. Okay, now the new HUD-VASH program actually started with appropriations in 2008. Congress provided $75 million to HUD to assist approximately 10,000 homeless veterans, and again, that was in the new HUD-VASH program. Based in part on what we had learned from the earlier program, there were some major differences between the original and this new HUD-VASH program, and among those were actually one of the important lessons that we learned was the need for flexibility, and as a result, there have been waivers of both regulations and statutes. That was provided in the appropriations language, provided that ability to HUD so that we could remove impediments to program operations. And also, the appropriations language gave HUD the ability to establish alternative program procedures. Next slide, please. Okay, based on the 2008 appropriations language, the VA identified in that first year 132 VA medical centers to participate in HUD-VASH, and there was at least one site in every state and also in DC and Puerto Rico. After that, HUD identified and then invited PHAs in the jurisdiction of each VA medical center and invited them to apply for an allocation of HUD-VASH vouchers, and that allocation The size of the allocation was determined in part on the relative need in that area, and also on a case manager to PHA voucher ratio. At that point, it was 35-1, 35 vouchers per case manager. Since 2008, Congress has provided new funding annually for additional HUD-VASH vouchers. And in 2012, as Nancy mentioned, we actually are receiving an additional $75 million for new HUD-VASH vouchers that will be will be available very, very soon. Every year, communities receiving HUD-VASH vouchers are selected based in part on geographic need, but using the homeless veterans data provided by HUD's Homeless Programs Office and also VA homeless numbers. Next slide, please. Okay. The HUD-VASH operating requirements were published in the Federal Register. The citation is there, docket number, but they were first published on May 6, 2008. Unfortunately, that original publication in the Federal Register left out one of the most important parts that had to do with the special mobility and portability requirements for the HUD-VASH program, one of the most frequently misunderstood or most confusing parts of the program. So a correction was published in the Federal Register on May 19, 2008. Unfortunately, it did not include the entire, it didn't include the entire notice again, but that notice is available on the HUD-VASH website at the address that was given earlier in the presentation. And the operating requirements outline the waivers and alternative requirements for the HUD-VASH program, and also make clear that normal voucher requirements of 24 CFR 982 apply if they aren't waived or if there isn't an alternative requirement specified. Next slide, please. As we've discussed, there's no waiting list. The veterans are referred from the participating VA facility and referred to their partner PHA. And after they are screened and found eligible by the VA, and the veteran agrees to participate in the case management. PHAs need to, in their files, maintain written documentation of those referrals. And probably at this point, most of you are doing that, but it is important for audit purposes, among other things. Next slide, please. Okay, when the veteran is referred, the PHA does screen the veteran, and has already been mentioned, that is limited screening, limited to income eligibility, and for lifetime registration under a state sex offender registration program. And assistance can only be denied for those reasons, not being income eligible or being on the sex offender registry, lifetime sex offender registry. And if there's portability involved, the receiving PHAs are also required to comply with those two VASH screening requirements. Next slide, please. Okay, growing out of that policy, I wanted to make clear that PHAs cannot screen for or deny assistance of a voucher for money owed to the PHA or for criminal or drug activity. That has been an area also of some misunderstanding and concern, but in fact, as I said, only the two reasons for denial of a voucher. And PHA cannot deny issuance of a voucher or admission into the program for zero income status either. Next slide, please. In terms of the income and minimum rent, a PHA can charge a minimum rent of up to $50. However, and this is important, if a veteran is awaiting notification about receipt of VA benefits or other forms of assistance, the PHA must grant the veteran a hardship exemption. And that the hardship exemption is discussed in the regulations at 24 CFR 5.630 3B. Don't worry about the citation. You will, since you will all have access to slides at the end of the broadcast, so you can refer back to this. But in any event, in the case of the minimum rent and the rent hardship, a PHA also cannot delay voucher issuance or admission until the benefits are received. Next slide, please. Okay, in determining the income eligibility, the PHA uses the normal rules of the voucher program that they would use for any voucher family, and that's at 24 CFR 982.201. And we urge PHAs to discuss these requirements with their partner VAMCs, and in the years that the new HUD-VASH program has been in existence, we know that that has actually been done quite widely, and I think to the benefit of everyone. One other area that actually is often questioned or misunderstood has to do with application of income limits at annual exams. And in the voucher program, HUD income limits do not apply at re-exams, only at admission to the program. Eligibility for continued assistance is by other rules, such as the still needing a subsidy or still qualifying for a subsidy. Next slide, please. For PHAs, income targeting requirements for the voucher program do not apply to the HUD-VASH program, but the operating requirements do give PHAs a choice. PHAs can include the admission of extremely low-income HUD-VASH families in their income targeting numbers for the fiscal year of the family's admittance if they wish to. Next slide, please. In terms of the lifetime sex offender registration, if the homeless veteran is subject to the state lifetime registration, PHAs can't issue the HUD-VASH voucher to the veteran. The question we often have, though, is if there's another family member that's the lifetime registrant, and the answer is that the family may be eligible for a voucher if the family member subject to the registration requirement is actually removed from the household. Next slide, please. Okay, issuance of the voucher or denial of assistance. It's important that one of those actions be taken. A PHA must either issue a voucher to the referred veteran or deny assistance. Families should not wait indefinitely for a determination. In the case of denial, the PHA is required to promptly send a denial notice to the veteran that states the reason for denial and provides for an informal review, and a copy of that notice must be provided to the VAMC case manager. Next slide, please. One of the areas where the HUD-VASH program differs from the regular program has to do with the initial search term. For the HUD-VASH program, vouchers, HUD-VASH family must, or a veteran, must have an initial term for housing assistance of at least 120 days. However, any extensions, suspensions, and progress reports are under the policy of the housing agency's administrative plan, and those apply only after the initial 120-day term. Next slide, please. Another area that's a little different has to do with the initial lease term, and the initial lease in HUD-VASH may be for less than 12 months, even if that's not the prevailing market practice. Every effort was made in developing these operating requirements to think of impediments, again, to veterans being housed, and if in fact initial lease of less than 12 months does make sense and will make the difference between the veteran being housed or not, it is a policy that does make sense, and it is provided for in the operating requirements. Another area where there has been a lot of confusion is particularly between VA facilities and PHAs and HUD and the VA. When we look at the data that is submitted to us, has to do with the point of program admission. And what should be considered the definition of admission to the program is when the unit selected by the veteran actually comes under housing assistance payment contract and lease, not when the voucher is issued, not when the veteran is at the point of referral to the PHA. Next slide, please. Okay, eligible housing. The regular housing choice voucher requirements regarding unit size, housing quality standards, payment standards all apply. There is a HUD publication. The title is A Good Place to Live. I looked to see if there was, it doesn't seem to be posted on at least our VASH website. I was able to pull it up rather quickly by using Google for HUD publication, A Good Place to Live, and it did pull up the brochure. It is very easy to follow with illustrations for various rooms of the house, and is a good thing for really for the veteran and the VA case manager. There'll be additional information given by the PHA at the briefing, but it's a very easy to follow and useful resource, A Good Place to Live. One difference for HUD-VASH from other voucher programs having to do with eligible housing is that in the HUD-VASH program, VA-owned units on the grounds of a VA medical center are considered eligible housing. And the citation in our regulations has been specifically waived in the operating requirements to allow that eligible VA housing in the program. Next slide, please. Turnover of the voucher when the veteran leaves the program. Upon turnover, the voucher must continue to be used for eligible veteran families referred to the VAMC. In some of the earlier programs, there was a one-time use, but definitely with this new HUD-VASH program, the turnover vouchers and the funding available for them will continue to be used for this population going forward. Next slide, please. Now we're getting to what is, I'm sure, probably the most misunderstood and most confusing part of the program, having to do with mobility or portability. And essentially, for HUD-VASH, there are two types. They are based on whether the family moves within or outside the referring VAMC's catchment area. And in any case of a portability or mobility move, the referring VAMC must always be consulted prior to the PHA's approval of a portability move. That is important. There have been certainly some problems with that where veterans just take off, and they definitely jeopardize their ability to continue in the program. Next slide, please. Okay, what I want to talk about first is moves within the catchment area of the referring VAMC. The veteran can live in the jurisdiction of another PHA within the VAMC's catchment area if the referring VAMC will continue to provide case management. Now, as many of you know, the catchment areas of many VAMCs are much larger than the jurisdiction of any individual PHA. So this is something that has come up quite often. And in the case of the desired move to a nearby PHA where the veteran can continue to receive case management from the referring VAMC, that would be approvable. The receiving PHA in that case must bill the initial PHA if it does not administer the HUD-VASH program on its own. Next slide, please. Now, the other part of moving within the catchment area of a referring PHA would be a case where the receiving PHA also administers the HUD-VASH program. And in that case, the family could move. The receiving PHA may either absorb the family or build the initial PHA. I mean, there is a choice, but whatever the choice, the VA must be consulted prior to the move and agree that case management services will be provided. So, in any case, this has come up quite often, and I guess it would take into account primarily the case management resources of the VA within that catchment area. Next slide, please. Okay, in the case of these portability moves where the which involve the initial PHAs partnering VA Medical Center, HUD has developed a form. It's a portability form, HUD-VASH attachment, and it is posted on the HUD-VASH website. And the form number is on the slide, HUD 52665, and it's specifically for the HUD-VASH program. And it summarizes the alternative requirements that apply to portability moves when the family's case management is being provided by the initial PHAs partnering VA Medical Center. If you have that kind of move, I think you'll find the form quite useful. Next slide, please. Now we go to the other kind of portability, and that involves moves outside the referring VA catchment area, which really is, I think, the simpler version. In that case, the VAMC that screened the veteran must first confirm that the new VAMC has an available HUD-VASH case management slot, and then if there is a case management slot, that the new VAMC's partner PHA has an available HUD-VASH voucher. The receiving PHA must administer the HUD-VASH, HUD-VASH voucher. So it has to be a move to the partner PHA of the VAMC that has the available case management slot. The family cannot move under portability if there's not a VASH PHA in the area to which the family wishes to move. And again, the family in one jurisdiction that has a HUD-VASH voucher can not simply pick up and move across the country as they might in normal portability. The first step has to be checking with the local, between the VAMCs. The local VAMC that screened the veteran will be consulting with the VA Medical Center in the jurisdiction where the veteran wishes to move, and then the next step would be that VAMC would check with their partner PHA to confirm that there is an available voucher, because the voucher does not move with the family. Next slide, please. Again, the family must be treated as absorbed by the new PHA. There's never a billing arrangement in these long-term cross-country moves, and the initial PHA's voucher stays with the initial PHA. Next slide, please. We're just about at the end. A few of the partner PHAs are what are called moving to work agencies, and they have the authority for a lot more flexibility than the other PHAs have in administering their voucher programs. But for HUD-VASH, vouchers must be administered in accordance with the HUD-VASH notices, including the HUD-VASH operating requirements. The funds are not eligible for fungibility under the PHA's moving to work agreement and must be reported separately from moving to work vouchers. Next slide, please. Finally, there is the Section 8 Management Assessment Program that PHAs are subject to. And since leasing of HUD-VASH vouchers will be dependent on referrals from VA medical centers, the unit month and budget authority associated with the HUD-VASH vouchers will not be included in the CMAP leasing indicator. That we've decided to continue that policy. However, as I'm sure all of you that have been administering the program for a while know, utilization of HUD-VASH vouchers is monitored separately. And next slide, please, and it's time for questions. That's the end of my presentation on the operating requirement.
Thank you, Catherine. So now we're going to take a couple moments to answer some questions. First is regarding, one of the first questions that have come up is regarding homeownership and veterans participating in the HUD-VASH program. Definitely, veterans can participate in the HUD-VASH homeownership program, or in the homeownership program through the HUD-VASH with a HUD-VASH voucher or with a regular voucher. Phyllis, do you want to describe that briefly about the HCV homeownership program?
The homeownership program under the Housing Choice Voucher program provides money to help assist the family with their homeownership payments, mortgage, interest, and principal. And the veterans, anyone who gets the voucher, unless there would be a restriction in the Appropriations Act from applying it to homeownership, can use it for homeownership. However, this is also dependent on whether or not the Housing Authority has a homeownership program, since housing authorities are not required to have one. It's their choice.
Right, and if they do have one, there would be separate requirements specific to the voucher homeownership option that the veterans would have to meet. But so far, there's been no impediment in terms of appropriation language, and veterans are eligible for the homeownership option if it's available in their area.
Great, thank you. Another question is, can a veteran have his or her girlfriend added to his voucher? And if so, can she remain in a VASH-funded unit while he is incarcerated? So first of all, in terms of the adding of a girlfriend, this will depend on a PHA's definition of family and who can be join a voucher household. And Phyllis and Catherine, please jump in if I'm saying anything incorrectly.
Well, one thing that's important is the PHA would use its own policies on adding family members after the fact. Then you go back to the regulations. There are no special provisions for adding members to the household. I mean, there are the required additions, the birth of a child, adoption, and court-ordered custody, but beyond that, it's up to the PHA's policies on approval.
Great, thank you, Phyllis. And in terms of after, if a veteran becomes incarcerated, let's say that a girlfriend is approved by the PHA to join a household, and the girlfriend has been living in the home with the veteran for a while, and the veteran then is incarcerated, the girlfriend is now officially part of the family, and so yes, she still can maintain that voucher and live at that house while the veteran is incarcerated. Keep in mind that if the veteran being incarcerated is against the PHA's policies, and it may end up that the family is terminated from the household due to whatever crime was committed. Unfortunately, we need to keep moving, and so we don't have too much time for questions right now. So if you could please move on to the next slide and to the next section, which I think is, yes, it's project-based vouchers featuring Phyllis Milkinson.
Okay, welcome everyone. This is the last session, so you can all breathe a sigh of relief, and I will go over the slides. Initially, we published a notice on project-based HUD-VASH vouchers, which is effective September 15th, 2011. Okay, so that's one notice specific to PBV for HUD-VASH. There's another notice published about the same time, which provides general guidance on the overall PVV program, this is also applicable to project-basing PVV. And there's pretty much not everything you need to know, but it's very comprehensive, the second notice on the PVV program. Next slide, please. Next slide. Okay, the limits on project basing, I don't know if all of you are aware of this, but the 50% limitation that we placed on the number of HUD-VASH vouchers that could be project-based was listed in a recent notice, 2011-50. However, the PHA has to stay within its 20% maximum budget authority. But let me just say one thing about that. In the year that you project base, you are limited to that 20%. However, in future years, if your budget authority and units are reduced, you do not have to reduce the number of HUD-VASH project-based units or project-based units in general, because you can't be going back and forth with how many you can do. You would be required to at least stay with the limit that you established and not be adding any future project-based vouchers unless, as PHA, you received additional vouchers. Next slide, please. Okay, this is very important because of some of the things that we've run across. If a PHA wants to project base any of its HUD-VASH vouchers, a proposal must be submitted to headquarters. And the most important thing is that the VAMC regional manager must be in agreement with the PHA's proposal. We have seen certain things where it may or may not have been run through the proper channels and certain things have to be changed. One of the things to look out for is the housing first model. So if there are going to be restrictions as far as that's concerned in the proposal, you have to be aware and make sure that it's removed from the proposal. The proposals must be signed by the PHA executive director or equivalent official, and the VA or VISN's director, and the VA network homeless coordinator. So we need to see these. I'm the one who reviews them, so we need to see all these signatures, and if not, you will be notified. In lieu of signing, though, the VA officials may include letters of support if they would prefer to do that in lieu of signing the proposal cover letter. Next slide, please. The proposals may be for existing new construction and rehabilitated units. These are some of the items that you have to include. And these are all in the notice too. Why the PHA wants to project base instead of providing tenant based assistance, the success rate of HUD-VASH voucher holders, and other voucher holders. So we want to see if it's harder for the HUD-VASH voucher holders to find units than regular voucher holders. Utilization rate and CMAP, we just want to see generally how well the PHA does in leasing. The amount of time, if any, that the HUD-VASH vouchers would be shelved for development. And I just want to put a note in here that a PHA does not have to shelve vouchers. It's not a requirement. Some do, especially small PHAs, because they might not have the vouchers when they need them. But if you have a big program and significant turnover, you should not have to shelve the vouchers. They're included in CMAP right now, so you might want to consider that too. Well, no, not the HUD-VASH, I'm sorry. I take that back. But project-based vouchers, those vouchers are counted in CMAP unless they're HUD-VASH. Okay, then description of the project, details, and this would be, is it a building with how many units are going to be HUD-VASH units, how many are going to be occupied by other families, etc. It is all spelled out in the notice 2011-50. Next slide, please. Okay, This, I'm going to tell you, you probably have to read this a number of times before you get the gist. And the gist of it is, and I will tell you up front, that if a housing authority does not have a regular voucher to give a family when it wants to move, or a HUD-VASH voucher, the family may be required to stay in the unit beyond the 12 months. So I will go through. A family may terminate the lease anytime after the first year of occupancy. PHA must offer the family continued tenant-based assistance in the form of a voucher or comparable tenant-based rental assistance. And again, we really just look at the vouchers. We don't know what the PHA has in comparable assistance. A public housing unit would be considered that. A HUD-VASH family that no longer requires case management cannot be terminated because it no longer requires case management. If a regular voucher is not available, the family will have to keep its HUD-VASH voucher until a regular voucher is available. Next slide, please. Next. Okay, again, the PHA may offer a regular voucher to a family that doesn't need case management. It's just what I said before. I was ahead of myself. Okay, the HUD-VASH voucher is not available at the time the family wants to move. The family could require the family to wait 180 days for HUD-VASH voucher. This is where you have to pay attention closely. Okay, next slide. Next. Next. If the voucher is still not available, this is after 180 days, the family must be allowed to move and the PVV assistance would be replaced with a regular voucher assistance unless the unit is taken out of the PVV contract. But if after 180 days the HUD-VASH voucher does not become available and the PHA does not have sufficient funding to give the family a regular voucher, the family may be required to remain in its PVV unit until such funding becomes available. So it's a very circuitous way of saying, unless a voucher is available, the family may have to stay in that unit beyond 180 days. It could almost be indefinite. We don't like to look at it that way. But the important thing is the next voucher that does become available must go to this family. Okay, next slide. Reporting. Okay, this is into PIC and VMS. VAMCs report veterans' case management data into their own system called HOMES. HUD and VA generally compare PH and VAMC leasing data to check for discrepancies. I think, and Kate, correct me if I'm incorrect, that the numbers are getting closer.
That's correct.
That's very good to know. And then the points that follow on the next slide will reflect the most recent notice on reporting, and the number 2011-53. We've really been punching those notices out. Okay, next slide. Next. Okay, the code VASH has been established for use on line 2M, special programs, to indicate that the family is participating in a special program. This code must remain on the form for the duration of the family's participation in the program by the initial and receiving PHA if the voucher is ported. This is something to look for. Okay, next. At the time a voucher is issued to veterans, PHAs must report issuance on the Form 50058, VASH and 2N, and Code 10 issuance of voucher. Eventually, if there's no issuance of voucher in the system, there will be no new admission or port-in allowed in the system. Right now, you'll just get a warning. The reporting of the issuance enables HUD to see how long it takes for veterans to become housed or if the veteran is never housed. Next. Next. When a HUD-VASH family finds an apartment and the lease is signed, then the PHA must enter Code 1 new admission on line 2A. The VASH code must always be maintained on line 2N throughout the participation of the family. I think we covered if the HUD-VASH family no longer requires case management, that and if it goes into a regular HCV program, then code VASH on line 2N is no longer applicable. One more thing that's not on here, if a family ports into a PHA before it ever leases up, it's a new admission. You will collect the portability information in Section 12 of the 5005A for vouchers, but that's the difference between a porting family had to have lived in another jurisdiction before. A new admission never lived in another jurisdiction. Next. Okay, I just covered that, the first one, and I covered the second one, and actually the third one too. Okay, next. Next. Okay, HUD-VASH vouchers leased and HUD-VASH HAP expenses are reported in VMS monthly using the appropriate VMS fields. The PHA should report all families that are supported by HAP funds under its own ACC. This would include families that are being served within the PHA's jurisdiction, as well as families for which it is billed under portability. Next. Okay, this is important too. If you have a ported family, you can't get it in both fields. It's more important that you enter it as a HUD-VASH family and not in the port-out field. PHA must retain appropriate records to support VMS submissions as they are subject to on-site reviews by HUD and the Quality Assurance Division. Recalculation will occur if a QAD review demonstrates that costs were incorrectly reported, resulting in excess funding. Next. Okay, HUD-VASH frequently asked questions.
No, Phyllis.
Yes.
This is where Teresa and I begin our segment.
No, I know. Okay, thank you for listening.
Thanks, Phyllis. Okay, Teresa. So we are, I guess, going somewhat slowly, and we need to complete this segment very quickly. Are you ready for this, Teresa?
I am.
Okay, you may need to speak up a little bit, Teresa. I actually couldn't hear you very well.
I will.
Wonderful.
Is that better?
Yes. Okay,
good.
Next slide, please. So just briefly, we just wanted to let you guys know, if you have a question, who do you talk to? Partnering VAMCs and PHAs generally answer questions and raise questions back and forth. PHAs, you can also contact the Network Homeless Coordinator or field offices, same for the VA case managers. And then at the national level, we also just wanted to give you a heads up about how we're structured. We have the regional managers who are all on this call, and then the voucher office, all of us except for our wonderful supervisor, Lori Rawson, are not on the, Lori's not on the call, but everybody else is. Then we also work a lot with the Office of Field Operations that oversees the activities of our public and Indian housing field offices. But anyways, just to give you a heads up about how we're structured. Next slide, please.
What is the primary goal of HUD-VASH? The primary goal of HUD-VASH is really to ensure that our target population of vulnerable chronically homeless veterans are permanently housed with case management and support services, and to ensure the veteran sustains in housing through recovery and maximal independence. If we don't house chronically homeless veterans, we aren't going to meet our goal of ending veteran homelessness. And so our big goal is to end veteran homelessness, and we're going to do that by obtaining and sustaining the veteran in permanent housing. And the next slide. Oh, there we go.
Ta-da! I thought we eliminated that. I guess we didn't.
I guess not. Okay, so if a veteran is interested in participating in the HUD-VASH program, who should he or she contact? And so there's several ways. One is we have a national call center for homeless veterans, and that's 1-877-424-3838 or 1-877-48-VET. And that will connect anybody who calls it, wherever they're calling from, to the local VA that needs to work with that veteran and gets the contact information, and that's one of the best ways to get in. Also, any interested veteran can go to the local VAMC. On the web, Veteran Integrated Service Network, some of them have contact information on their website. And many VAs also have brochures that they get out to community shelters, soup kitchens, and other agencies with their contact information. So there's lots and lots of ways. Basically, go to your local VA and ask for the homeless program or call the National Call Center. Next slide, please. Oh, that looks like me too.
It is.
Is staying with a family member or friend considered an episode of homelessness? And basically what we're saying is that if a veteran is staying with family or friends, so that couch surfing piece, that alone does not make them homeless. But it is that act of being evicted that will count as an episode of homelessness. And so you have to get a letter that says you're going to be having them leave your house, and that gives the documentation of the eviction and supports that episode of homelessness. And so what we want people to do is to use your best clinical judgment using the guidelines that are given to determine homelessness and chronically homeless status. And that's, some of this stuff is a little squishy, so you got to really use your best judgment following the HARF Act guidelines of these guidelines. Next slide, please. Kate.
And this is me. And I just want to say before answering this question that number one, all of the questions that you sent in, we are going to try to answer the questions, and they'll be placed on the HUD-VASH listserv. We'll send them out via the HUD-VASH listserv, as well as the VA's SharePoint. And I also want to request that you guys, we're really sorry for this going over, but it would be great if you stayed on for another 5 to 10 minutes. And hopefully we'll get through all of these FAQs. Okay, so regarding birth certificates and Social Security cards, the answer is no. According to HUD regulations at 24 CFR 5.216G, families are only required to provide an original government-issued document with a Social Security number. And the VA's Form DD-214 qualifies. PHAs may require additional identification, but because of the flexibility in HUD regulations, we encourage you to save time and accept the minimum required. And this may change in the HUD-VASH operating requirements in the near future, so you may be required to only accept the DD-214 form and other types of forms from the VA. Next slide, please.
Okay, this is me again, Teresa. Why doesn't a veteran have to participate in or finish treatment before getting permanent housing? And what we know is that VA is adopting housing first because it's the best practice, and there's data to support its effectiveness. So the fact that it's more effective than running people through treatment before they get permanent housing is one of the things that we're trying to do. We also know that it's really difficult to treat someone who's homeless because you can't locate them, you have medication problems, their stressors are high, which makes their symptoms worse. So there's lots of reasons why housing someone makes it easier then to help them engage in treatment. And then the third part is that the housing itself becomes an incentive to work toward staying housed. It changes the way that they think about themselves. They like that. They want to keep it. They like their housing. They want to keep it. And they have to do things that help them to be able to follow the rules to stay housed. And that may mean medication or treatment in some way. And so we engage veterans in treatment through that ability to keep their house. Next slide, please.
So you are a developer and you have a great project that would be awesome for the HUD-VASH program and for homeless veterans. can you apply directly for HUD-VASH funding to assist with this project? And the answer is no. Only PHAs receive and administer HUD-VASH vouchers. If there is a PHA in your community that administers HUD-VASH vouchers, then that PHAs and their partnering VAMCs may have talked and decided that there's a need for project-based vouchers. So you should contact the administering PHA to determine if they have made this decision. And please keep in mind that PHAs do need to hold a competition for the awarding of project-based vouchers. Also important in this process is input from the HUD field office. They conduct or oversee the environmental review process of the project-based voucher application submission. And also VA regional staff also have input into approving the project basing of HUD-VASH vouchers. Next slide, please.
Okay, is it acceptable for the VA case managers to review original documents on the PHA's behalf? And the answer to that is a little complicated, but yes, the VA may review the documents that the PHA needs to make sure they're complete, to see, you know, just generally if it's what's going to be needed. But really it's the PHA's role to determine if they meet the PHA guidelines and operating requirements. So we can look at them, but we can't really make any decisions based on them. Next slide, please.
Okay, so after a family has been admitted into the program, the normal provisions in the HUD regulations apply. Also in PHA policies, when a new family is included, or when a family wants to include new members of the family, they will have to abide by PHA policies, except for the birth, adoption, or court-awarded custody of the child. Next slide, please.
Can a participant use a HUD-VASH voucher to move long distance? For example, a HUD-VASH family wants to move from California to Florida. So yes, the vouchers were designed to be flexible to allow porting both to a close location or to a distant one if appropriate. For VA, the case managers at the new VA in the area where the veteran chooses to live must have the capacity to provide case management. And so there has to be an available voucher, and the port has to be coordinated between the involved case managers. And if those things work, then the PHA in Florida would absorb the family. Next slide, please.
So when a veteran has been issued a VASH voucher, does the veteran need to wait a year before he or she can move under portability to another PHA's jurisdiction? And the answer is no. In the case of a non-resident veteran in the regular voucher program, there is a requirement that that veteran leases up with a HUD-VASH voucher in the PHA's jurisdiction for a year before porting, but that has been waived for HUD-VASH. Also, the other regulation that has been waived is the requirement that PHAs enter into an initial lease with an owner for a year. That is a requirement in the regular program unless the PHA makes an exception. Next slide, please.
Can the earnings of veterans participating in compensated work therapy programs, including incentive therapy, be excluded as income under 5.609C9? And so basically participation in CWT is based on the treatment needs of the veteran and the judgment of the treatment team. It's a temporary work hardening treatment program with different components. And as therapy, the hours may vary each week, and income will vary from payday to payday. Compensated work therapy usually does not last more than about 6 months, and it has the goal of assisting the veteran to gain employment in the community. So we ask that you look at the number of hours that are being worked, how long, and all of those kinds of things when you're excluding or including the income. And, you know, it's another step toward independence. And so that's one of the things that's very nice about compensated work therapy. It helps veterans to then get employment in the community. Next slide, please.
Yeah, and like Teresa said, if this income is to be excluded, it would be under that that Reg 5.609C9, which covers temporary, non-recurring, or sporadic income. So the PHA will, it's the PHA's discretion, will have to consider the circumstances of that veteran's participation. There are many other, or quite a few other questions answered on VA benefit programs. So please check HUD-VASH website for our Q's. Actually, there was a link to the Q&A document that was sent out in the reminder emails for this webinar. So look at the Q&A document for more information on the exclusion of VA benefits from a veteran's income. Next slide, please.
How long does HUD-VASH last? There's no hard and fast rule on HUD-VASH. It is clinically based and also income-based, and it's also based on the veteran's ability to follow the public housing authorities, the landlords, and other rules and laws. So it depends on how long they need it, and it depends on how long they qualify for it. And as it says, you can use them as long as the voucher as long as you need to, and continues to meet their criteria. Did I answer that well? Next slide, please.
And then you're right, Teresa. And then after the veteran's completion of case management, the PHA has the option of using one of its regular housing choice vouchers to assist the family. So the veteran, you just remove that VASH code from line 2N on the 5-8 form. And when you do that, the VASH voucher will then be freed up to assist another veteran family. Next slide, please. I think this is me. Yep.
Yes.
Okay, so if that takes place, that you've decided you have a free, if a PHA has a free voucher and they'd like to transfer that veteran over to the regular HCV program, is that family subject to the PHA's waiting list? And the answer is no. The family is not subject to the waiting list because technically the family is already a participant in the PHA's voucher program, just in a subset of that program with a HUD-VASH voucher. So upon converting to the regular program, they're not subject to the waiting list. Next slide, please. And what happens to the voucher if the homeless veteran dies? The PHA could use one of its vouchers to continue one of its regular vouchers from the regular HCV program to assist the family and then free up that HUD-VASH voucher for another veteran family. But if a regular voucher isn't available, the family definitely can continue utilizing the VASH voucher. And once that voucher turns over, that VASH voucher turns over, it must go to another homeless veteran family that's referred from the partnering VAMC. Next slide, please.
And just to add on to that, this is if they're already housed when the veteran dies. Okay, what happens to the voucher if there is a divorce? Sadly, in the event of a separation or divorce, the veteran retains the voucher. And so the program is set up for veterans, and it needs to stay with them. And there's some slight variations in that, such as if the veteran is separated from the family because they're redeployed, they would be able to continue to use it then. But in most separation or divorce situations, the answer is going to be no. It goes with the veteran. Kate?
Yeah, next slide, please.
Oh, sorry, forgot that.
That's okay. So this is a complicated question. Let's say a veteran has been admitted into the VASH program and the PHA learns that the family owes money to the PHA, or the PHA learns after the veteran has been admitted into the program that that veteran has a criminal record. So can the PHA, once they learn about this, after a veteran has been admitted into the program, can they then terminate that veteran? And the answer is no. A PHA can't terminate a family for a reason that cannot be used for denying admission. So a veteran can't be denied admission for having a criminal background before they're officially admitted. And if they've already been admitted, the PHA can't then turn around and terminate that veteran for something that happened before they even entered HUD-VASH. Next slide, please.
However, a HUD-VASH family can be terminated for program violations that occur after the veteran's admitted to the program. This goes back to what I was saying earlier about how we use the program to engage veterans into treatment by helping them to prevent this from happening. So if they're not participating in a way that supports their continuing by breaking the rules, by being too loud, by, you know, the various things, not paying their rent, all of those kinds of things, and they could lose their voucher. Let's see, and we strongly encourage PHAs and case managers to work together during that termination and discuss, if possible, how they might retain the voucher, such as treatment, disability, or if there are other circumstances that would need to be considered before they do that termination to try to help get the veteran to stay in. Because remember, our goal is to house homeless veterans and to keep them housed. Next slide, please.
Can a PHA, excuse me, I'm very sorry, I have a cold. Can a PHA refuse to admit veterans that have been terminated from the HUD-VASH program due to serious lease violations, you know, et cetera, these types of violations that normally under a PHA's regular program could cause them to refuse admission to these veterans? And the answer is no. A PHA cannot deny assistance to a veteran for any grounds under those two regs that cover reasons for denying admission. So if a veteran has been terminated from the program and the case manager works with that veteran to kind of address some of the issues that veteran was having, then definitely the PHA and the VA case manager can work together to then readmit that veteran into the program. Next slide, please. The only exceptions are if a family if the family's income has risen significantly and then therefore they have become income ineligible, or if the veteran has committed a crime that puts them on a lifetime sex offender registration, then those are both reasons for denying. Like, you know, the first time that they were applying for the program, those are both reasons for denying them admission. But we emphasize that in order to avoid these cases, prior to the PHA's termination of the veteran, the PHA should work with the case manager to discuss, excuse me, I'm sorry, I had to cough there. The PHA needs to contact the VA case manager to discuss these reasons for the veteran's termination. Next slide, please.
The PHA and VA case manager should work together to agree on the appropriate action and determine if termination of the veteran's assistance can be avoided. And then if they decide that termination is the appropriate action, the PHA and VA case manager should discuss the circumstances under which, if any, the VA may choose to re-refer the veteran family. So we do want this to be a partnership where we are discussing the thoughts and feelings around the termination to determine if this veteran would be someone that can come back through without causing a lot of grief and heartache for those who are involved. Next slide, please.
Will the HUD-VASH vouchers be fully renewed? This is our last question, and the answer is that it is definitely HUD's intent to renew all HUD-VASH vouchers. However, such renewals are always subject to congressional appropriations. So definitely express all support that you have for the HUD-VASH program to your congressional office and let them know how much it is needed in your community. So that is the end of our FAQ segment, and unfortunately, I'm so sorry, but we're out of time. And we're not able to respond to some of the questions that have been raised at this time. However, we will do the best that we can. We're going to get a list of the questions that have been asked that have been typed in, and we will do the best that we can to respond to those and send them out to you via the listserv and also posted to the VA SharePoint site.
This is Ann. I also want to mention that if you do not if you think of a question later, please send that to any one of us, and we'll include that on our questions as well, our answers.
Yes, or and you can also at our field offices and locally, the network homeless coordinator and other VASH program, HUD-VASH program managers on the part of the VA, there are many very knowledgeable people about this program, so also consider just asking locally your questions if they are not answered in our follow-up document from this training. So Nancy, do you have anything else to add before we close?
No, just thanks to all who dialed in and continue to do the good work you've been doing. Thank you all.
Thank you, everyone, so much for everything that you do. And please consider responding to the survey when you receive it, a link to it via email. Thank you so much. Take care, everyone.